In this episode, we're diving into a topic that's not talked about enough, yet it plays a massive role in egg quality, implantation, miscarriage risk, and overall fertility health. And it's all about methylation and homocysteine. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you're going to learn what methylation is and why it's essential for fertility, detoxification, and hormone balance, how high homocysteine levels can quietly sabotage conception and pregnancy outcomes, and how to optimize methylation naturally, even if you have MTHFR or other genetic variants. So let's talk about what methylation is and why it matters for fertility. So methylation is one of the body's most important biochemical processes. It's almost like a light switch. So it can turn genes, hormones, and detox pathways on or off. So methylation helps your body process and clear out estrogen efficiently, which can help prevent estrogen dominance. It can repair DNA, which is highly critical for egg and sperm quality. It can produce neurotransmitters that can affect your mood and stress resilience. It can convert homocysteine, which is a potentially damaging amino acid, into safer compounds. And it can even support implantation and placental development. And the unfortunate part is when methylation isn't working optimally, your detox pathways slow down, inflammation builds, and your reproductive system becomes less efficient, especially in the areas of egg quality, implantation, and sustaining an early pregnancy. So let's discuss the role of homocysteine. So homocysteine is a byproduct of methylation. You can think of it like the exhaust that needs to be processed properly. And when methylation is sluggish, either due to nutrient deficiencies, genetics, or inflammation, homocysteine can build up. And here's the problem. High homocysteine damages blood vessels. It impairs oxygen and nutrient delivery to the ovaries and uterus, and it can increase the risk of poor egg quality, implantation failure, recurrent miscarriage, preeclampsia, and pregnancy complications. This is honestly not a test that conventional providers are running. It is a lab test that I run on every single client, and we like to see homocysteine levels below 7.2. And maybe you've gotten it run by your doctor, and you're still falling within the normal lab range, which it depends on the lab, but it could even be under 15. If your doctor told you that you're normal and that level is above 7.2, that's not an optimal level for fertility. So check your labs, or you can request this lab to be done as well. So, why does methylation get blocked anyways? There can be several reasons your methylation might not be working well, even if you're eating healthy. So there's genetic variants like MTHFR, COMT, or MTRR, and these affect how your body processes folate, B12, and methyl groups. There's also a lot of folate confusion. So, unfortunately, most prenatal supplements, and even ones that are recommended by doctors still to this day, contain synthetic folic acid, which your body may not be able to convert properly if you have any degree of an MTHFR mutation. And this can actually worsen methylation issues. And then, of course, there's nutrient deficiencies. So, we need specific nutrients to fuel methylation, including methylated B vitamins like folate, vitamin B12, vitamin B6, choline, and also magnesium and zinc. If you have a high toxin burden, exposure to pesticides, plastics, and heavy metals can deplete methyl donors in the body. Also, if you have chronic stress or inflammation, cortisol and inflammation can steal methyl groups and increase oxidative stress. So let's talk about some signs that your methylation might be sluggish. So here's some common red flags that I can see in clients. You're waking up feeling exhausted even after what feels like you should have gotten a good night's rest, right? 7 to 8 hours. You have a history of miscarriage or difficulty conceiving. You experience anxiety, mood swings, or brain fog. Your homocysteine is above 7.2, and you have high estrogen or symptoms of estrogen dominance like PMS, tender breasts, heavy periods. Maybe you don't do so well if you have folic acid in your supplements. Maybe you do experience some symptoms, or you have a family history of heart disease or clotting disorders. So even symptoms like a poor detox tolerance, headaches after wine, or chemical sensitivities can be clues. So how can you support methylation and lower your homocysteine naturally? Definitely top of mind is to test, don't guess. You want to request a homocysteine blood test and, if possible, an MTHFR genetic testing as well. And you can also run a full methylation panel or organics acids test for deeper insight. You want to check and potentially upgrade your prenatal. So look at your prenatal, see what it says on there. Does it say folic acid or does it say folate and then list exactly what kind that they're using? So you want to choose a formula that contains methylated B vitamins. You want to boost your choline intake. Choline works synergistically with methylfolate and B12 for methylation and egg health. It's found in eggs, especially the yolks, grass-fed liver, and supplementation if needed. Adding magnesium and zinc. So both are essential cofactors that keep methylation running smoothly and support hormone detoxification. We ideally, of course, want to lower inflammation. So eating an anti-inflammatory diet rich in leafy greens, berries, cruciferous veggies, omega-3s, and limiting processed foods, alcohol, and refined sugars. We want to reduce our toxic load, so filtering your water, avoiding plastic storage, and switching to clean beauty and cleaning products. And of course, supporting the liver. So your liver is where a lot of methylation happens. So including foods in your diet like beets, lemons, dandelion root tea, and cruciferous vegetables. So a lot of what I see clinically is when we are able to lower homocysteine into an optimal range and support methylation, we are seeing improved egg quality and ovulation patterns, easier conception within just a few cycles, healthier pregnancies with fewer complications, and better energy, mood, and stress resilience overall. So this is not just a fertility hack. This is an overall health and wellness and vitality. It's like a whole body upgrade. So let's recap what we talked about today. We discussed how methylation impacts hormone balance, egg quality, and detoxification, why high homocysteine can sabotage fertility, and what your optimal levels should look like, and the key nutrients and lifestyle shifts to support a healthy methylation and reproductive health. So I just want to let you know if you've struggled with unexplained infertility or recurrent miscarriage, or your labs show high homocysteine or an MTHFR gene mutation, this is your sign to go deeper. Book your free fertility strategy call today. We can review your lab results together, identify your hidden root causes, and create a personalized plan to restore your fertility from the inside out. So I want to thank you so much for listening to this episode. I hope you have a beautiful day, and I'll see you on the next episode, released every Tuesday and Thursday.